Hi everyone. Now we are going to discuss about myocardial infraction. Introduction. Myocardial infraction, commonly known as heart attack, is a serious medical condition that occurs when blood flow to the part of the heart muscle is suddenly blocked. This blockage prevents oxygen from reaching the heart tissue, lead to damage or death of the heart muscles. Most cases are caused by a blockage in one of the coronary arteries due to atherosclerosis, a buildup of fatty deposits in the artery valves. When a plaque ruptures, the blood clot can form and completely obstruct the blood flow. MI occurs from prolonged myocardial ischemia associated with coronary thrombus, which includes branches of coronary arteries which are usually agglutinated in order of frequency, or anterior descending branch of the left coronary artery, right coronary artery, left circumflex artery, and the infraction does not involve the right ventricle usually. The next we are going to discuss about the definition. Myocardial infraction, which is commonly called as heart attack, is the death, which means necrosis of the portion of the heart muscle due to prolonged lack of blood supply caused by a blockage of one or more coronary arteries. It occurs when blood flow to the heart muscle is suddenly reduced or stopped, leading to damage of the heart tissue. Myocardial infraction is also defined as the irreversible necrosis of a part of the heart muscle, is almost always due to coronary atherosclerosis. It results ischemia. The next we are going to discuss about the etiology. Myocardial infraction occurs when the blood supply to the heart muscle is reduced or completely blocked, causing damage to the heart tissue. The main causes includes: first one is atherosclerosis, which means the fatty deposition in the blood vessels. It is the most common cause, and it also occurs due to the buildup of fatty deposits in the coronary arteries, which causes rupture of the plaque and can lead to blood clot formation and blockage of the blood flow. The second one is coronary artery thrombosis, which means formation of a blood clot in the coronary artery that blocks blood supply to the heart muscles. The third one is coronary artery spasm, which can cause narrowing or tightening of the coronary artery, which can lead to reducing the blood flow, can be caused by stress, smoking, or drug use, example cocaine. The next one is embolism, a clot or other raw materials which travels from another part of the body and blocks a coronary artery. And the next one is coronary artery dissection, a tear in the wall of a coronary artery leading to reduced blood flow. And the next one is severe anemia or hypoxia, which can cause reduced oxygen carrying capacity of the blood, can lead to insufficient oxygen supply to the heart. So, in etiology, the main factors are coronary thrombus, coronary embolism, prolonged coronary vasospasm, prolonged hypotension, aortitis, atherosclerosis, erytheromatous plaque, and the vasculitis, which means inflammations of the blood vessels. The next we are going to discuss about the pathophysiology. In the pathophysiology, when excessive cholesterol leads to atherosclerotic process, the first step is the accumulation of subendothelial lipid. This is called as fatty streak formation, which can cause endothelial cell injury and inflammation. The LDL is the major atherogenic liquid which undergoes oxidation, and it is cytotoxic, which causes plaque formation. And the next one is disruption of endothelium leads to adherence of platelets and release of PDFG, which means platelet derived growth factors. The local cells will undergo proliferation and mature fibrous plaque is formed. This leads to coronary artery obstruction. It is usually seen in left anterior descending branches of the left circumflex artery and rare in right ventricle. So the first one is endothelial cell injury and inflammation, and the second one is plaque formation, and the third one is plaque rupture and thrombogenesis. Fourth, reduced blood supply and increased oxygen demand. Fifth, myocardial ischemia. Sixth, myocardial cell necrosis, and the seventh one is acute myocardial infraction. The next we are going to discuss about the clinical features. The clinical features of myocardial infarction are the signs and symptoms seen when a person has a heart attack. The most common signs and symptom is chest pain. Chest pain, which is usually the most common cause, and the pain lasts for more than 20 to 30 minutes. In severe central or left-sided chest pain occurs, it is described as pressure, tightness, squeezing, or heaviness. It is not relieved by rest or nitroglycerin. In angina pectoris, the pain which causes squeezing, crushing, or aching pain, mostly in left arm, epigastrium, and chin pain. The next one is pain radiation. The pain may spread to left arm or both arms, and also the neck, jaw, shoulder, and the back. Next, the common symptom is shortness of breath, which means difficulty in breathing due to reduced heart function, nausea and vomiting, palpitation, dizziness or syncope, anxiety or feeling of doom, dizziness, mental confusion, tachycardia, pericardial pain may develop at the second day, and the central cyanosis. These are the clinical features which occurs in angina pectoris. Next, we are going to discuss about the diagnosis. In diagnosis, first one is blood examination. In blood examination, leukocytosis with high ESR are seen. The second one is urine test. In urine test, albumin and high ESR, sugar in some cases. The next one is chest X-ray. In chest X-ray, pulmonary edema will be seen. The next ECG. In ECG, there will be ST elevation, deep T wave, and Q wave inversion. And the next is cardiac enzymes. In cardiac enzymes, creatine kinase, aminotransferase, lactate dehydrogenase, and cardiac troponin is seen. The next one is echocardiography. It is helpful for localized or generalized left ventricular function by observing valve motion. And the next diagnosis procedure is Doppler electrocardiography, which is helpful for diagnosis of mitral regurgitation and VST after myocardial infarction. Then next we are going to discuss about the management in myocardial infarction. Immediate management of myocardial infarction is initial treatment, which includes morphine, which relieves severe chest pain and anxiety. And the second one is oxygen given if oxygen saturation is low or patient has breathing difficulty. The third one is nitroglycerin, helps dilate coronary arteries and reduce chest pain. And the next one is aspirin. And also we have given thrombolytic therapy, anticoagulant, stool softener, and sedatives for myocardial patients. The next medications, medical management, which includes antiplatelet drugs, aspirin, anticoagulants, heparin, beta blockers, which reduce heart workload, AC inhibitors, which improve heart function, statins, which lowers the cholesterol and prevent future attacks, pain relief, morphine is needed. And also we can give IV access, narcotic analgesics, facilities for defibrillation, rest, and also we have given converting enzyme inhibitors. IV we have to given beta blockers and stool softeners. The next, there are some surgical management if needed, like which includes coronary artery bypass, grafting surgery to bypass blocked coronary arteries. The next we are going to discuss about the complications in myocardial ischemia. The complications are arrhythmia, stroke, heart failure, ventricular fibrillation, and hypertension. Thank you.